Everyone, my name is Cindy Hipley. My lesson plan was developed for a PICC line dressing change. The objective that I have chose to base this video on is for the student to display the proper supplies needed for a safe PICC line dressing change using aseptic technique and to demonstrate proper dressing change. So I chose this specific um, task to be done just due to working in the cancer center. A lot of times we do PICC line dressing changes weekly for our patients if they have PICC lines. PICC lines are also very common. You'll see them in the hospital, outpatient settings, and even home care settings. So my targeted group of learners would be individuals that are newer nurses or even students, but mainly newer nurses or nurses that have never done dressing changes before. The delivery method would be face-to-face, ideally in a clinical skills lab with a mannequin arm and dressing kit, different dressing kits, so that the instructor myself would be doing the dressing change first and then having the student do one afterwards with supervision. So it's important to note different influences whenever it comes to learning. So we have a lot of diversity, and we also have to consider physical and learning disabilities whenever we're developing a care plan. Some other things to discuss are legal and ethical obligations that may have an influence on our lesson planning. So with physical and learning disabilities, it's important for us to be familiar with the American Disability Act and to, accommodate students or, nurses that might have some extra needs when it comes to the learning session. This may, for physical disabilities, this may require, having some extra space if a student's in a wheelchair, or for a learning disability, the student might have to have some additional time after the lesson with the rest of the group. So it's important for us to accommodate, and ideally it's better to know up front. That way we can make sure everything is in place for the student. The learning theory that I chose for this plan was the experimental learning theory. I felt like this was a best fit for this lesson plan because it's basically learning by doing, having these students, watch me and then do a hands-on activity will help them learn, and also keep it interactive in the classroom to keep them engaged. It's important to address that we might have different learners in the classroom, whether we have, younger students or maybe some older nurses that are learning. So we might have to make some adjustments just depending on the individual in the class. Some ethical concerns just to be aware of include, um, when educating a group of students, just kind of disclosing too much information. If a student has a disability, this should be up to the student whether or not the rest of the class should know what their disability is, or, a lot of students are open with it, but some might not want anyone else to know, so we have to respect that as educators. And another ethical concern might be spending too much time helping a student where the other class gets a lack of education. So it's important again to accommodate those maybe after class, if so we can keep the class going and have the other students also learn. To engage students, I would first start out by introducing myself and just ask them if they've had any experience with dressing changes before for the PICC line, kind of to gauge where we're at, or they new totally beginners, or have they seen this done, have they done this before. After that, I would do a PowerPoint presentation with a handout for them to take. This just goes over safety, comfort, and also materials needed, and then just some line maintenance tips. It's good for the student to put this in their binder just to keep, with them so they can reference back to it. It's pretty short and concise. That way it's not lengthy, and they can reference it quickly. That will also be attached to the submission, so you can take a look at the PowerPoint and the quick reference guide. So After we would do the presentation and then I would give them a reference sheet, I would then go ahead and present the dressing change to the class. That is also in a video attached um, of me doing the dressing change. So I would do that first, kind of walk them through step by step, doing it a little bit slower so they can gauge a little bit better. I would also allow for them to ask questions through this process if they needed to. After that, I would go with a student one by one and watch them demonstrate a dressing change. A lot of them most likely will need, some guidance or help just because it's not something that most people pick up immediately. So it would be close supervision and one-on-one with each student. After that is all done, I would gather the class back up, kind of like a huddle, and just see if there's anything that they need, any more questions, any kind of rationales to help them, um, you know, understand what the important things of a dressing change are, and why we need to do this properly with sterile technique to prevent any kind of infection risk. So after that, that would be the lesson conclusion and just kind of an open discussion to see if there's anything else that they need. Materials that we would need to use would be ideally like a mannequin arm versus using a patient for the first time. A lot of patients are okay with, someone walking a student through, but ideally it would be better to at least get familiar in a clinical lab setting where we can take more time, and if there's an error or mistake, it's not that big of a deal compared to maybe it being on a real patient. We would have the PICC line dressing kits, and it's important to note that a lot of times the dressing kits, depending on the manufacturers, they will have different things in them. So we would have to go through and make sure, maybe some kind of checklist to make sure that the student has all the proper tools. So they're not all in sterile gloves and then realize that they're missing something they need for the dressing change. And then ideally having a projector to go over the presentation would be best, and that way we can have the whole class go over it together and have any questions if they need to ask anything. Teacher reflection, I would just try to look at where all my objectives met. Did I have the students engaged, and was the lesson plan appropriate for the population that I'm teaching? Do I need to make adjustments next time? Do I need to make it a little bit more individualized? And I would also look at any barriers that are present that maybe could be prevented in the future. Maybe I didn't have the skills lab for a long enough period of time. Maybe next time I can plan to have that out longer. Do I have enough materials? Did I give students enough time to ask questions? Did I rush them through it? There's a lot of barriers that could be present that it would be good to reflect back on. Otherwise, my video is attached with a PowerPoint presentation and the reference list that I made for the students. Thank you.